But when it's flexed, they become tight. So when the joint is extended, side-to-side movement can occur readily. But when the joint is flexed, the tightness of the ligaments prevents side-to-side movement. We need to understand the names that are given to those side-to-side movements at the MP joints. Spreading all the fingers apart is called abduction. Bringing them all together is adduction. Those are useful terms for describing those collective movements of the fingers. But when we're speaking of an individual finger, it's often simpler to speak instead of ulnar deviation and radial deviation. Now let's move on to the interphalangeal joints. The proximal and distal IP joints are very much alike. They're different from the MP joints in that they only allow flexion and extension. The head of the phalanx is curved mainly from front to back, with a slight depression in the middle. The base of the adjoining phalanx has a corresponding curve to it. The capsule of an IP joint is much like that of an MP joint. But the collateral ligaments are different in that they're equally tight in flexion and in extension. Now let's move on from the fingers to look at the bones and joints of the thumb. The first carpo-metacarpal joint is the joint which gives the thumb its special position and a great deal of its special mobility. Let's take off the metacarpal heads to see the joint surfaces. Here's the first CMC joint. It sits in front of these other CMC joints and at an angle to them. Because of this, the thumb and its metacarpal lie in front of the fingers and their metacarpals. Because of the angle of the carpo-metacarpal joint, the thumb faces not forward as the fingers do, but sideways across the hand. The articular surface on the trapezium is curved in two planes, from side to side and from back to front. The base of the first metacarpal is curved in the same way. The shape of the joint surfaces enables the first metacarpal to move in this plane and in this plane. We'll name those movements in a minute, but first let's look briefly at the other two joints of the thumb. The MP joint of the thumb is unlike the finger MP joints. It's much more like an interphalangeal joint. It permits only flexion and extension. On its flexor aspect there are two tiny sesamoid bones, which are embedded in the joint capsule. The one interphalangeal joint of the thumb is just like the IP joints of the fingers. Now, let's go back to the CMC joint and see how the first metacarpal moves and what the movements are called. Movement away from the second metacarpal is called abduction. Movement toward it is adduction. Movements at right angles to this axis are called flexion and extension. These two sets of movements often happen in combination. As it makes these movements, the first metacarpal also rotates around its own long axis, as the pen is doing. When it's abducted and flexed, it rotates medially. When it's adducted and extended, it rotates laterally. This rotation can't happen in isolation, but only as part of those other bigger movements. It happens because of the curious and complex shape of the CMC joint surfaces. This important and complex movement of the thumb is called opposition. It's a combination of abduction, flexion, and medial rotation, all occurring here at the CMC joint. Because of the rotation that occurs, the tip of the thumb ends up pointing toward the fingers. Once the thumb is in opposition, flexion at the MP and IP joints brings the tip of the thumb into contact with the fingers. We've looked at the bones and joints of the hand and at the movements they're capable of. Before we move on to look at the muscles which move the fingers and thumb and the tendons by which they act, there are a number of important pulleys and sliding structures that we need to understand. These structures guide the direction of pull of the tendons as they cross the wrist joint and pass along the fingers. we'll look first at the two big pulleys at the wrist, the flexor retinaculum and the extensor retinaculum. Here's the flexor retinaculum. It's a tough, unyielding strap of fibrous tissue. The flexor retinaculum is the structure that forms the roof of the carpal tunnel. It's attached on the radial side to the scaphoid and the trapezium, and on the ulnar side to the pisiform bone and the hook of the hamate. As we'll see, the median nerve and all the flexor tendons to the fingers and thumb go through the carpal tunnel. The flexor retinaculum branches off in two places, here and here, to enclose two small separate tunnels. This one on the radial side encloses the tendon of flexor carpi radialis. This one, superficial and on the ulnar side, encloses the ulnar artery and nerve. We'll be returning to the flexor retinaculum later to look at some important structures that arise from it, the palmar aponeurosis and some of the thenar and hypothenar muscles. Let's go round now to the dorsal aspect of the wrist to see the other big pulley, the extensor retinaculum. It runs obliquely from this ridge on the radius to the ulnar styloid, the triquetrum, and the hamate. The extensor retinaculum has a number of deep extensions which are attached to the underlying radius. These divide the space under the retinaculum into several small separate tunnels. All three wrist extensors and all the extensor tendons to the fingers and thumb pass under the extensor retinaculum. Now let's look at the structures in the fingers and in the thumb which hold the flexor and extensor tendons in place, allow them to move, and guide their direction of pull. In each finger, this structure, the flexor tendon sheath, provides the two flexor tendons with a smoothly lined, tightly enclosing tunnel to run in. The sheath starts just proximal to the MP joint and extends all the way to the distal phalanx. To see the sheath better, we'll divide it. Parts of the sheath are thick and fibrous, and parts of it are thin